First, though, I'd like to give a little bit of background around Fusion Cell and how we ended up in this world of COVID-19 consulting, and specifically around athletics, because if you had asked me in March what COVID-19 was, I would have said it's something that's happening over in China right now. So I was probably in the same seat as most of you, but Fusion Cell, the roots of it are a staffing company that that harnesses military veteran talent and brings that talent to the civilian workforce. So that's the majority of what we do. The majority of our recruiters are Air Force veterans, 20, 30 years in the Air Force, that are building these networks of military veterans across the country. So a lot of our clients nationally are big companies like Bank of America, Sig Sauer, smaller companies as well, everything from startups across all industries. So in March, when COVID hit, like happened in all your worlds as well, our world got turned kind of upside down a little bit because a lot of the clients we were dealing with went into a little of a hiring freeze area. So the conversation we had as a group was, are there unique skill sets that the military can bring to the civilian world right now, given this circumstance? And immediately across the board, my recruiters came back to me saying, yes, emergency management. And as a civilian, I said, well, what's that? And they explained to me how every base across every branch of the military forever has had a virus outbreak plan and a pandemic operation plan. It's just part of what every base has to have. And it's the emergency managers who are responsible for building these plans, enforcing these plans, and also the ones who've been deployed into scenarios like SARS, H1N1, Ebola, the pandemics that we have seen in recent years. I asked what the backgrounds were of these folks, and they basically explained to me, Mike, who's going to do most of the talking today. They're board certified in many cases, epidemiologists, public health officers, biostatistics, pharmaceutical sciences, biology, all the buzzwords that we're starting to hear in March. So we quickly started to gather up some of these folks who a lot of them were currently working on the COVID issue through the military. A lot of them are in the reserve and the guard. A lot of them have been out in the civilian world. And we started working with companies as well as institutions that had put together these COVID-19 task force. Almost every school had one. I assume a lot of you guys are probably on it, especially the facility folks, but also companies. And we started to talk to them. The question was, well, how many of the folks on your team have experience with pandemics? And the answer was always none. And we started to come in to say, regardless of where you are in your plan, we can come in and help look at where you're at. We can help fill in the holes. We can bring in some expertise because our team has kind of been there and done that. And we found a lot of our early interests came from schools. And we're up in New England. A lot of them were independent schools. And I can give I'll give you a little view of some of those schools. It's pretty recognizable. You know, places like the Holderness School, St. Paul's, Kimball Union, Island School, right? So you're looking at boarding schools, you're looking at day schools, you're looking at schools that have been around for 100+ years, where obviously academics is usually, in most cases, the primary focus, but athletics is a big part of the culture as well, right? And we started working with these schools on what's the fall gonna look like. And we were building the plans for reopening. So looking at everything from their facilities, their student flow, their screening, their gating, everything having to do with opening the school back up. It naturally flowed as we got towards August into, well, now that you've helped us open, can you help us with athletics? And that's been a primary focus for us probably over the last month and a half. We did a lot with the fall, and stuff has now shifted to the winter. So we've done things from K to grade 5, grade 6 on-campus activities, like what should we do with these kids at recess? We've done gating and milestones through phase 1 through 4, where you start with individual workouts, and then you move to skills and drills, and then you move to scrimmages, and then interscholastic. We helped with individual sport protocols, like we're doing basketball right now. Facility planning, a big piece, right? Everything from the HVAC to how you clean those buildings, and all the protocols for distancing within. And we've done league-wide protocols, you know, scenarios where you have schools from different regions even that want to play each other. Well, what should the baseline rules look like so that there's a certain amount of safety? So again, if you had asked me in March, if this is what we would have been spending the majority of our time in as we came into the fall, I wouldn't have said so, but we've been fortunate enough to be able to gather probably the only group of people I think in the country that can say they have experience with a pandemic, which is the military. And it's been a very nice opportunity for them to show how much their experience can make a positive impact in a different way, which has been school. So I'll let Mike talk about himself and his background, and then we're going to kind of get into a little bit of the science of what COVID is and why it makes it difficult, specifically in athletics, and then kind of how we've approached that.
Thanks, Matt. So Mike, that's me. It's my second favorite topic to talk about other than COVID. So my background is pharmacology, way back in the day at the University of Toledo. And then the Air Force grabbed me and said, do you want to go become an epidemiologist and a public health officer? And I said, absolutely, that's been my dream and my passion. Because I hate counting to 100. And so then I went and I researched what is epidemiology and public health. And it turns out it's a great fit for me. I love it. It was everything that I didn't know I wanted. So I went to the University of South Florida, go Bulls. And then from there, I've been all over the country, Spokane, Washington. I'm currently down in Sumter, South Carolina. My kid goes to Wilson Hall, so we are a Baron. From the beginning, but we're going to be moving to the Space Coast. So if anybody's got Florida recommendations on independent schools, I'd love to hear them after this. But yes, 10 years with the Air Force. I started off with disease planning, and that was taking a plan that was in existence and had been added to and added to and added to and became unworkable. And so we threw that plan away. And then we started from scratch. And so we created a new living working document. And the Air Force loved it. They took it and it became the template for all of the bases in the United States. And then the Department of Defense took it and took pieces of it and made it mandatory pieces that go in everybody's base, so across all the services. So we had a lot of success with it. And this was just post H1N1, so this was 2010. And the big focus was pandemic influenza. And a lot of those principles have come back to play as we talk about COVID. But as Matt said, we've transitioned from what I've been doing in the military and the planning side and the public health and breaking that chain of infection, whatever the disease may be. And we've transitioned that into bringing that experience into civilian markets and specifically within schools, airports, and businesses that want to reopen and have the safest reasonable environment for people that are coming back.
Let me see here. I think we did want to have here, right? So we are going to talk through, like I said, we kind of checked the box on fusion cells. So we're going to get right into athletics and COVID. We're going to talk a little bit about the science, not in great detail because I think it's been ad nauseum talked about, but from Mike's perspective, some of the current guidance, some of the non-negotiables, and then we're going to talk about our methodology for how you develop some of those plans and then get into the Q&A. We've kind of gone through this already. Where the strike zone has really allowed us to be effective here is we're able to bring, like I mentioned, guys like Mike, ladies like Mike as well in the military, board certified public health experts with the backgrounds that are needed to combat this sort of a disease. They've done the infectious disease control already. They've dealt with pandemics. They know how to interact with Health and Human Services, the FDA, OSHA, so on and so forth. And really what we've been bringing to these schools in some cases is readiness assessment plans. So we'll do a gap analysis of here's where you are and here's where you may be and here are the different paths you could take to get there. We can help create those. We can help put those into place. What's really happened with a lot of these schools, though, these 15, is we've also turned into their de facto kind of on-call consultants. So when the unexpected happens and the parent question comes in and they want a great answer for it, the question will come to us and we'll help. We've jumped on the phone with teams. We've jumped on the phone with groups of parents. We've jumped on the phone with faculty and staff. So that it's the science of it is coming from an epidemiologist versus being translated across things people have seen on the internet, so on and so forth. But the biggest thing I think why the schools have enjoyed working with us is our goal is to work with the school to get to where they want to get to. Right? It's not to come and tell you what you can and cannot do. It's to come in and say, where do you want to get to? And if there's a way to get there, leveraging the science, we're going to figure out a plan to help people get there. And that's what we've been able to do thus far. So far, so good. Mike, we'll go into the challenges here.
All right. There's a lot of challenges. And I think the big takeaway is that as you start building your plans and as you implement these plans, you got to think of it as different layers of protection. And so every single layer is going to have some, Matt makes the point, it's like stacking pieces of Swiss cheese, and making sure that those holes and those faults in those plans don't align and translate into a disease process. So some of those different sciencey things that happen, you have pre-symptomatic people. So people that have been exposed, they're developing the disease process, and they're in the population. So there's typically a 2 to 10 day lag between when you are exposed and when you develop the disease. But in that time frame, before symptom onset, you got a couple days where you can transfer that disease to other people, which makes it kind of hard to track and trend because it's people that are otherwise asymptomatic. So we call them pre-symptomatic because they're going to develop those disease processes, the signs and symptoms. But then you have asymptomatic people, the people that can transmit disease, but you'll never know it because they don't get sick enough. And this is really more toward the younger population. So kids have milder disease. Sometimes they are more likely to be asymptomatic. So screening may not always pick up on disease process within that population. But remember that this is a disease that spreads person to person. And so that transmission is similar to flu, but it's a little bit more contagious than flu because the CDC just recently reevaluated the transmission protocols. And in certain circumstances, as we talk about basketball here and being enclosed in spaces that may or may not be properly ventilated, heavy breathing can increase aerosols, which makes it even more of a challenge. But then there's also the human factor, that complacency, the fatigue, because we've been dealing with this for 200 plus days, and people just are sick of wearing masks, right? And they're sick of being distant, and they want to see their family again. So as you get into the holiday season, Thanksgiving and whatever other holidays that you celebrate, and you have those close gatherings, you got to remember that that's also a point where there's a lot of interaction, sometimes travel, different regions, so different risk profiles. So take that into account as you're focusing on sports and bringing people back. But then to top it all off, it's also an election season, and everything seems to be politically charged these days. The science is out there, but a lot of times what you'll see is people picking bits and pieces out of scientific articles that support their view, and not really considering the rest of the article, the other 18 pages of published documents. So really navigating that political science versus actual science is key to making a great plan and making sure that it's as safe as possible. So as you think about places that give you recommendations, you're getting noise from everywhere from the World Health Organization at the international level to the CDC at our national level. You've got state-specific guidance, you have governor's orders, you have conference-specific stuff, and then down to what does your local area say you have to do. But the big focus in the very center of the slide is that it's all based on that scientific publication that happens, right? So as new data comes out, as more studies are conducted, and COVID is probably the hottest topic right now, you're gonna see recommendations change. And it's not because the science is bad, it's because we're learning more. And so as we learn more, we change our hypotheses and we test them out. And if it sticks, then that's the new marching order. So it's not really we had bad science before, it's that we have better science today. So there's always state differences. If you are talking about travel, sports-specific travel to go play a different school in a different state, or even sometimes within your own state, different counties are going to have different disease profiles. They're going to have different mask requirements. There may be a travel quarantine associated with it. And even the sports might not be allowed in that specific area. Those schools may be foregoing sports for the foreseeable future. So things to keep in mind as you go into the sports season. Restrictions are always going to be out there. So it's knowing the rules of the game that you're playing and knowing what restrictions are in place so that you have the best chance of succeeding and winning. So there are some sticking points that we have seen. Matt, if you can go to the next one.
Yep.
And it's really around the focus should be the academic culture, right? And how well is your school prepared to deal with challenges within the framework of what you have implemented? So if there's an exposure on an athletic team, are non-athletes within the academic facility going to be exposed, and are they going to be required to quarantine? And then more importantly, are they going to develop the disease process? Because if the rules and regulations, the policies and procedures of the school are ineffective at preventing disease transmission, then sports is actually a bigger risk for everybody within that population. So within that framework, there's always going to be those screenings. We talked about screenings being sometimes ineffective in the younger populations. And so you may have to go above and beyond and add temperature screenings, even if it's not required by state mandates. But then there's also the option for testing. That could be individuals, that could be pool testing. So everybody spits in a cup and then you test that for COVID. But then there's also other sampling procedures that are out there that are a little more gross to talk about, wastewater and all that, just to define what the disease profile is within school. But then there's outside of school, those extracurricular sports that are not associated with the academic institution, so club sports. My kid's in gymnastics at a local place, and she plays tennis outdoors at a tennis court that is not under Wilson Hall's purview. But it's a lower risk sport, and we've made that determination. If there's an exposure, then she's just going to be out for a couple weeks, and that's the nature of the game. And so as you talk about facilities, there's definite considerations in how the facility is equipped to handle those. So we will jump into that. We've talked about the culture, we've talked about location. So facility-wise, really it's knowing the science and the why as you talk about facility and infrastructure upgrades. Knowing maybe making a policy about restriction of certain sports within the club realm. And then how do you address recess and mass breaks and all that in the academic institution? But how does that translate into sports? All right, so like I said, we have developed plans and procedures for a decade or so, revolving around pandemic influenza and airborne and droplet transmission. And the number one takeaway I have for you is if you can do nothing else, it is to adjust the HVAC system within your buildings. The American Society of Heating, Refrigeration, and Air Conditioning experts, ASHRAE, are really the foremost people that do research into HVAC systems. And they've put out pretty good guidance on what filtration level you need to have, and also other mitigation strategies for buildings, whether it's an indoor sport or an academic institution. The EPA has their list N of disinfectants that are effective against COVID, but that list is extensive. It's pretty much everything on the market. If you were to just do a quick Excel sheet, you'd probably have 45 pages of printouts, over 1,000 products to choose from. So you have to figure out which one is going to work for your facility, and that may be based on kill time. So a faster acting product, it may be an eco-friendly product that you're looking for, depending on the culture of the school. But then we get into health screening. So those first two are dealing with the building before people get there. Health screenings are helping to keep the most healthy population within the building. So if you're sick, stay home. But health screenings can help identify people that are sick, specifically around temperature. So if you take a log of temperatures and you compare it over a couple days, you may see a trend of somebody's temperature going up. Maybe not at the fever threshold, but it could indicate that it's likely time to start doing some interventions with that person and maybe excluding them or requiring them to see a physician. So now that you've excluded sick people and you've already made your building as safe as possible, it's really re-emphasizing those behaviors. So keeping that 6 foot of distance whenever possible, those mask mandates to limit source spread of COVID. And that's going to be for your asymptomatic people or pre-symptomatic people. And then hand hygiene. So keeping yourself safe, keeping the things that you touch safe for other people are the big things. And all those work together to make a really good plan. And the idea is that those different 6 layers of protection all work together, but they all have some flaws in them. And so they work together to help eliminate a lot of the risk. These are the control methods. So as we talked about, engineering is making that building safe. So making sure your ventilation systems are up to par, that you're disinfecting. You might have to define occupancy limits specific to sports that are being played indoors. This could be restrooms as a high target or locker rooms. And then how do you transport? How do you get to and from a game? When do you need to screen? What kind of bus are you taking? Are the windows down, windows up? There's a lot of considerations in there. Porta potties at some events. Porta potties are really treated just like regular restrooms. They should be cleaned at the same frequency of a restroom. But the main focus with a porta potty is making sure that you have the facilities available for people to wash their hands. And so you limit that contamination of the hands, which then touch the face multiple times during a sporting event. Excluding sick people is your number one thing that you can do outside of engineering control. So keeping the healthiest group of student athletes on the field. But that exclusion could require a little more in-depth stuff like travel quarantine. Some states might let you test out of quarantine after a certain number of days. That's travel related. If there's an exposure and it's a medical quarantine, there's no testing out. That's a 14-day hard stop. And then you get into that behavioral control. So doing a daily screening, maintaining logs, doing a health check of your kid, just that thumbs up, thumbs down. How do you feel today? Do you have any of these signs and symptoms? Anything crazy going on in your life? Really, crowd control. When you talk about sporting events, maybe that policy around spectators. Is it one family can visit? Is it just one parent? Is it nobody can be in that area? And so that may change depending on the venue. So if it's a sports stadium, a football field outside, and you have open seating, it could be a little more lax. But if it's going to be an indoor event, basketball, and if you're specifically doing mask off and heavy breathing, and there's a potential for aerosolization, then maybe the right answer is no spectators and live stream it. All right, so each sport, and this is kind of an overview of what you would look at. So what does a sport have in terms of close contact? Is it going to be played indoors or outdoors? When you're making that close contact, how many times does it happen and for how long? Are you wearing masks? Is that a policy and procedure that's already in play? You are typically dealing with older students for a lot of these sports, which is kind of a double-edged sword because if you think about what you do with these students, you turn them into critical thinkers. So they understand the why, but then they can sometimes choose to ignore it, like most adults do anyway as well. But really it's re-emphasizing that their health affects other people. And so trying to keep them as healthy as possible also keeps everybody as healthy as possible. Shared equipment is big when you're talking about contaminated hands. Players that might be at a higher risk, so students with asthma or COPD, things that affect the lungs, it's a bad outcome for COVID. So you want to probably make sure that there's communication to parents, specifically the high-risk parents of high-risk students, and just let them know that there's risk, and if they choose to accept it, here's the defined data that's out there from the CDC. And here's some of the negative outcomes and increased rates of hospitalization, and let parents make that choice when talking to their student. We talked about spectators, we talked about travel risks, but really size of the team and how you gate is going to be critical. So those medical milestones that you have to hit. As you talk about the individual sport, and this is really where you start classifying what you're playing. So cross country could be considered a low risk sport. You may have to stagger start times, but typically as you're running and you're not around anybody else, if you're using a chip timer to determine winners, you can get to a very low risk on that sport. If you talk about something that's more moderate, that might be your soccer teams. And there's a lot of, we were talking about this before we jumped on, but there's a lot of published data over soccer because it's probably the #1 sport in the world. So people have studied the amount of close contact and contact times during the sport. And it really comes down to, it's unintentional in most cases, and it's short duration, and it really puts soccer into a moderate risk instead of a high risk. But the facilities that you use to play sports are just as critical as assigning a risk to them. So if it's an outdoor sport, less risk because you have infinite fresh air that you're going to be breathing. If you go indoors, you're really requiring mechanical filtration and other interventions for the air that you're going to be breathing. And that air typically stays within that space. It's going to be conditioned to whatever ambient temperature. So just keeping that focus as you talk about the HVAC facility, HVAC within those facilities. The types of contact, unintentional versus intentional. I have played rugby for 16 years. I've loved it, every minute of it. Now that I'm old and fat and slow, I've moved more towards jiu-jitsu because weight is my advantage in that one. And so both are high-risk sports. I don't play either of them right now, but I'm hoping to get back into both of them. But really, it's intentional contact, which is a big driver because you know that there's going to be an exposure time when you're in very close proximity. But that contact time, it's going to be critical in assessing the risk of an individual sport. So as we said before, the first thing to consider is how well your school can deal with the challenge within its environment. So that challenge being a COVID exposure. If you have a school where a COVID exposure happens and 2 other kids are excluded and they develop a disease process, there's a weak link in the chain somewhere, and maybe it's time to reconsider what sports are being offered, and maybe communicate to parents to stop or slow down with some of those club sports or outside of the school sports. Cohorts are always a good thing because you can track and trend disease processes, and it makes contact tracing super easy. So a good example would be football, where you have some athletes that are defense only, you have some athletes that are offense only, but then you have a little bit of mixture and some that will play both ways the entire game. Masks and social distancing and hand hygiene, respiratory etiquette. When you're thinking about sports that are played outside or inside, just re-emphasizing that people should not be spitting. Typically, when you spit, you're going to be pushing things out of your lungs as well. And so it changes that risk a little bit. But there's ways to get to sports. And so if you start at a lower phase and you do a 2-week quarantine to make sure everything is in place, both in the academic facility and in the facility that you're playing in, then you can peel back a layer of risk. So you start off with skills and drills as your most conservative. If you're outside, that's great, but really no contact. And then you can move into like pods or team scrimmages and see how that goes. So you're still in that defined cohort of 1 team. And then after 2 weeks, if there's no disease change within your school or on the team, then you peel back another layer and you accept a little bit more risk. And that's when you start playing teams in competitions. But some sports are going to require some modifications. That could be getting rid of those common touch items, those shared equipments, maybe spacing people out on the bench a little farther, mask use if you're not in active play. It's all going to be sport and school specific, and probably even league specific as well. And so layouts might be modified. So as we've gone through this, one thing that has stood out as a big challenge is how do you bring in officials? Because typically they're not assigned to a school. Sometimes they're just people that have certification in a certain sport. And so if you think about a boarding school as being a closed bubble in essence, you control those students' lives for most of their life. And so you're bringing in a person from outside that bubble that could transmit that disease. So it's really a higher risk item as you talk about sports play. And so we've developed some courses of action, all of which are safe. Some are more conservative and some are a little less conservative, but really, if you can pull people from the same region so that you have the officials coming in at the same baseline risk as the players, that's a pretty low risk solution. The
And
more
so to Mike's point on this slide, I think it's important. This is just an example of one of the reports that we develop for our schools, whether it's sports specific, facility specific, or even league specific. We never tell a school what to do. What we're trying to provide you with are multiple approaches, all of which will deliver a safe level of play. But as you see, when we say lower, we mean that's if your acceptance of risk is at the lowest point, right? Moderate is, okay, you're willing to accept a little bit more risk in this particular area. High is, it's the highest level of risk that you'd be willing to accept, but understand all three of these approaches fall within what we would consider as reasonable operating in a COVID-19 environment. What makes the school decide which the lower, the moderate, and the high they may choose will vary. It could be culture, it could be physical limitations of your building itself, it could be your geography, it could be your budget, right? And what a lot of schools will do is in some areas where they may have to go on the higher risk area, HVAC is an example. Some of the buildings just won't be able to do the things that the lowest category will do. They may go a little higher, but that might mean that their disinfectant is going to be on the lower end, right? Or that their spacing, right? Or the scheduling that they do to have less people in the building at one time. So what we're always trying to do when we work with individual schools is, for them specifically, what are those areas? And then what are three paths that could work for you? And then, you know, we can help you decide which is the best. But at the end of the day, it gives you different paths. And you may change over time as well. You may start out in a moderate area, but the disease changes in a good way, and you could slide to a higher risk profile. Or the disease could change with a spike, and you may have to shift down to the lower end. But what we're looking to do is really arm our partner schools with the science and with the expertise, so they can make good decisions and build their own good plans.
Yep. Thanks, Matt. That was a very good ad. And to that point, sometimes there's no high-risk solution. And we will absolutely say no high-risk solution. These are your two options. Figure it out, which one you want to go to. And if you can't get to it, then that might be a reason not to play that sport. And then in some cases, there's only a low-risk option. So we say, don't even waste your time going down this path, because this should be a policy and procedure.
Yeah. So I want to be mindful of time. We're at about 20 minutes of. We're just going to give a couple screenshots of some of the examples of some of the products we've delivered for some of the schools, and then obviously want to get into the questions. So we've done products, school-wide sports plans for different schools. We've done grade level specific activity guides. Like, these are the safe things that you can do. I don't know how many K throughs are in this group. We've done sport-specific protocols. We've also done league or conference-wide plans. So again, just to give an example, this is a multi-page, 6-page document, I think, that we delivered for one of our schools. You're not expected to be able to read this, by the way. It's just an example. But this was a plan that we pulled together for a school for the way that they were going to approach all of their sports, right? Starting with sports and cohorts, and how those two intertwine. And then it goes into, Mike, pretty much all those different areas that we talked through, right?
Yep, and this one, the focus was, how do you effectively play sports and get to that intramural play when you have different cohorts that are there on different days or different weeks. And so it was more of the focus on hybrid models and how do you not break those bubbles as you're doing sports programs.
Right. This is an example of, this was for an elementary to middle school to say, what the heck can we do with these kids during the day? We want to keep them active, right? And it's an example of, we pulled this together to say, here are all the different things that you could do. Here are the general guidelines. Here's how you should handle shared equipment, mass, and then here's the lower risk, here's the more moderate, and then we had some other examples as well. Yep. So again, things that that were on demand specific for one of our clients. This is page 1 of an 8-page basketball guide that we're building as we speak, right? It's a hot topic right now. There are a lot of things that go into basketball. There's the screening and the testing even before they get on the court. There's what do you do in the actual building? It's what happens on the court. What do you do with spectators? What do you do with officials, right? So it's pretty in depth, and it takes into account the latest even CDC guidance that came out on Monday, Mike, where now they're saying this could be aerosolized, right? So
Yep.
it
October 5th was that change. Yeah.
yeah. So even to give a little bigger example, so again, this is just an example, but this is a real document that we're developing. This is a league that has come to us to say, how can we play basketball? And one of the big parts around that was, how do we know that our building is safe for basketball? And how do we know that, what if of the 7 teams that are in this league, which ones, what's the baseline of safety? Because we could do everything we can in our building, but if we go to someone else's building who's not doing the same testing and doesn't have the same HVAC capabilities, we're putting our entire school at risk, because then these students come back and then they go back in the classroom and there's a ripple effect. So this is an example of, multiple questionnaires that went out to athletic directors, individual interviews with Mike, and it gives the schools an idea of this is where the particular schools are right now. This is their current, for instance, HVAC capability. Here's what they're planning on. Here's the upgrades they're planning on. Here's their fresh air percentages. Do they have the screenings already, both routine on the academic side? What's the mask policy? But then the notes on, green means this facility is ready to roll. Red means is they're not right now, but here's what they're going to be doing, right? So again, it's just the level of detail that a lot of the athletic directors and the facilities are going through to make sure that they're feeling comfortable about the way that they're going to approach basketball. So this is an example of some of the different just types of projects that we've done at the school level, on the activity level, the sport level, but then even at the conference level. I think bottom line is every situation is very unique and very different. Every one of these that we've done have come with different pieces and parts as well. At the end of the day, the school is defining as well for us where they would like to get. And what we're trying to do is work with them to create multiple paths to get there, that they can decide what's right for their particular school. So that's our last piece. Selfless plug at the end before we go into the questions. If anyone obviously has any interest in having a chat with us and seeing if it's something that we could help you with, whether it's an individual sport or conference-wide or even particular questions, Mike and I's information is right here. I'm sure Sherry could make it available to you guys as well. Typically what we'll do is we'll just have a free discovery call and talk through specific your situation, what you're trying to accomplish. And we kind of figure out on that call if it's something that you guys, it would make sense for or not. So with that, we'll kind of get to maybe some of the questions, and we'll let you guys kind of dip into Mike's brain.